Namaskar, I am Dr. Rahul Pandit. You are watching the 506th non-stop edition of Dr. KK's Med Talk show. Let's have the headlines of the day. The World Health Organization has warned on Monday that global risk from Omicron variant is very high based on early evidence, saying that the mutated coronavirus could lead to surges with severe consequences. At least 70 countries have now imposed travel restrictions from several African countries following the discovery of the variant. Number of cases of Omicron COVID-19 variant have not no case of Omicron variant has been detected in India so far, says the Union Health Minister Mansukh Mandviya in Rajya Sabha during the question hour. The Union Health Minister has updated guidelines for international travelers. All travelers coming from countries categorized as at risk would have to undergo a mandatory COVID 19 test at the airport, regardless of their vaccination status, in addition to the requirement of an RT PCR within 72 hours before traveling. BioNTech, Moderna, and Johnson & Johnson are working on vaccines targeting the Omicron strain in case their vaccines are not effective against the new strain. 123.25 crore vaccine doses have been administered so far under the nationwide vaccination drive as per the Health Ministry data. Let's have the topic of the day. Topic of the day. So the topic of the day is Omicron, the new SARS CoV-2 variant, and I am being joined by Professor Shashank Joshi, and he had taken a 2 weeks hiatus to sort of go back to the drawing board, rejuvenate, a bit of vipassana, a bit of yoga, a lot of education, which is what professors do. Professors just take a hiatus, and we all wonder what happened to them. They just go back and they come back with knowledge brimming out for all of us so that we can collect some pearls of wisdom from them. So, Professor Joshi, welcome, and it's indeed a great honor and pleasure to have you back with us on the show. After 2 weeks, we could not do the show for various reasons, and I am really happy that you are here today. But on this occasion, in 2 weeks hiatus, a lot has changed since we did the last show together. The Jopa show, the Jopa show 3 weeks ago and Jopa show today brings in a newer variant today for us to discuss, which has been sort of the cause of concern for the last 5 or 6 days. So, sir, I would like you to begin with the introduction of what this new variant is. Why should we be so worried about? And where are we heading as a world? Because now I remember you always talked about Vasudeva Kutumbakam. We are one family as a world. And where do we head with this new variant? Up to you, sir. Professor Joshi.
So thank you so much, Dr. Rahul Pandit. We all know Dr. Rahul Pandit. He is the star of COVID in India and the world. He is the chief of critical care at the Fortis Group of hospitals, predominantly in Mumbai, but across the nation. He has been an active member of the Supreme Court nominated task force for COVID nationally, and one of the most vibrant members and the chief of critical care task force for Maharashtra government. So today we are very right, Dr. Rahul Pandit, that we are suddenly stumped by this new strain, and we all know that all viruses mutate. Are my slides visible, Rahul?
Yes, but they are not in the PowerPoint. They are not. They are sort of in what do we call that mode? I don't know. But I'm not able to see individual slides. I'm able to see all the cluster slides together.
We're able to see the cluster slides. So let me
not,
stop sharing.
Not anymore. Yeah, you stop sharing.
So let me stop sharing the slides. Let me talk. The science of the virus. So in the first 5 minutes, I'm going to talk about the Omicron, the science of this virus, and then Dr. Pandit is going to calm all of us down. So Omicron is nothing but a new variant of the same SARS CoV-2 virus. So the first virus, when it came from the Wuhan province of China. And we all know now that there was a Wuhan Institute of Virology. A lot of experimentation was done there. Possibilities, there was an accidental spillover, and this is being investigated by the World Health Organization. There was a special committee to investigate this, and then from there it spread across planet Earth. We all know that it's a RNA virus. It has bats as its reservoir, and there was a intermediate host like a pangolin where it jumped. Then there were this all happened in the November and December months of 2019, and that is why it got a nomenclature of SARS CoV-2 with COVID-19. And COVID is a disease, and the SARS CoV-2 is the virus. And the whole 2020 we were invaded by this virus. And somewhere in September of 2020, there was genomic analysis being done in two countries. One was South Africa that time, and second was United Kingdom. And from the Kent County of United Kingdom, they discovered that there was an unusual strain, and that later on went on to become the so-called alpha strain. And that same time, the South African Genomic Sequencing Lab, which is in Kulu Natal, one of the biggest biologists and genomic scientists, was able to discover the South African strain then, or the African strain it is called, that went on to be nomenclatured as beta strain. And around the same time, probably the Delta was being born in some parts of Maharashtra. But we have no clue what was happening because we didn't have data, we didn't have genomic sequences, we don't know how it occurred, why it occurred. And around the same time, we had this whole Manus province in Brazil, which had more than 80% herd immunity, because 80% of the population had COVID, but still there was another variant which came in, and that went on to become the gamma strain. And eventually, that we know that somewhere in February, we were able to pick up the Delta strain, and Delta invaded the world. So whether it was alpha, whether it was beta, whether it was gamma, it was replacing. And currently in the last 6 months, the most dominant strain on planet Earth in COVID is the Delta strain. So what happened in South Africa, Botswana and some neighboring countries is very unique. In the last 2 weeks, in a span of 10 days, the whole strain of the beta, which was replaced by Delta in South Africa, the whole Delta got replaced by the B1.1.529 variant. And this variant has more than 30 mutations on the spike protein, more than 10 mutations on the ACE receptor protein, and compared to that, beta variant had only 3 mutations, Delta had only 2. And this is all from specimens collected between 11 November and 23rd November from Botswana, South Africa and Hong Kong. So obviously this strain, what do we know? In South Africa, there is community spread, and Botswana. In South Africa, the transmissibility is probably more. Rest of the world, we don't know. Its impact on immunity, possibly more, but again, data is emerging. Impact on severity, data is emerging, but we don't know. And transmission, we know it's airborne droplet, but currently it is sporadic and travel related. So that is the core of that whole strain. And this virus, suddenly we don't know how it came, whether it was constantly there in a chronically infected individual, just like we had, or whether was it from a country, coming from a country like Botswana, which had a poor genomic surveillance. We don't know. But it's 21K. So we know that, 201 or 20I is alpha V1, the 20J is gamma V3, and 20K is nicknamed the Omicron. And the main thing, which when people were doing the genome frequencing analysis, the S gene was failed. There was a S gene target failure, and in most provinces suddenly they saw, because in the South Africa, in their National Health Laboratory Service, it is called as NHLS, and Leslie Scott leads that team there. And Leslie told them that all the TACPAC assay which they use, the S gene was being deleted. And they saw that from the province of Gauteng, the samples collected between 12th and 20th of November, all the 77 samples had the HGTF, H gene target failure. That means the H gene was deleted. You know, normal coronavirus has N gene, the E gene, the S gene, the ORF gene, and all the 77 out of 77 samples from the Gauteng province from 12th to 20th of November. It's very recent. Today is just the 30th of November. So just 10 days back, all the samples had H gene deletion. And whatever now hundreds of samples which are being collected by the National Government Service of South African Labs, and the results which will all be available and getting sequenced, all of them are showing this H gene deletion. And this H gene deletion was synchronized with a very high CT value. So the CT value was also very high. And this had all these mutations. So fundamentally what happened that the entire Delta got wiped out and we had birth of the Omicron. And Omicron replaced it. So on the 26th of November, this Friday, today is Tuesday, 30th of November, just 4 days back, the Technical Advisory Group on SARS CoV-2 for Virus Evolution of the WHO, this is called as TAG-VE, is an independent group of experts which periodically monitors and evaluates for evolution of the SARS virus, for mutations, virus behavior. And in a single day, they were so stumped with the results that they said that this is a variant of concern. The reason is because this is 500% more competitively infectious and probably twofold worse bad mutations on the spike than Delta. So normally the one strain had a viral competitive advantage of 30%. The Delta strain is around 70%. And the newborn Omicron strain is 500%. So obviously the only thing which we know today is it is rapidly spreading in South Africa. And compared to Beta or Delta, it is rapidly outpacing these strains. So that is very clear. There are mutations on the spike protein like RBD, receptor binding domain, NTD, N-terminal domain, which are resistant to neutralizing antibodies and therapeutic monoclonal antibodies. How that will shape up in patients, we don't know. Then also there are mutations, cluster of mutations or constellation of mutations on the S1, S2 furin cleavage site, which will cause enhanced cell entry and enhanced transmissibility. Again, how it will pan up in transmissibility? Probably yes. In South Africa, it is definitely showing more transmission because their numbers have gone up. Their test positivity rate from 1% has climbed up to 30% in Gauteng province. And the country test positivity rate has crossed 10% now. And then there is a NSP6 deletion, which was also seen in alpha, beta, gamma, and lambda, not seen in delta, which is basically antagonizing the interferon and evades the innate immunity. So this made it more transmissible. And the other big thing which needs to be confirmed in human beings is it has a special mutation on the nucleocapsid, which is R203K and G204R, and that increases the infectivity. So that is something which is very clear. But the real worry is that it may be resistant to all the medications we know. It is super transmissible. Its R0 probably is more than chickenpox. It has replaced Delta. Its transmissibility is more. But whether immune escape can occur or not, we don't know. Whether it will cause severe disease or virulence, we don't know. Early trends from Dr. Andrea Coetzee, she's our friend from South Africa, and Dr. Rahul Pandit has given a plenary oration at our Commonwealth Association. I also spoke on the same Omicron virus that day. She shared with us. She's the chairwoman of the South Africa Medical Association, and Professor Akhtar Hussain also is a member of the South African Medical Association. They shared that the disease they are seeing right now is in young population between 20 and 40, mild disease, mainly with fatigue, with sore throat, scratchy throat, etc. So she says there is no need to panic, but the hospital admissions are going up. So there is a threefold increase in hospital admissions, but no increase in the ICU admissions, which is very reassuring for a person like Dr. Rahul Pandit. And the other thing is there is a 20-fold increase in oxygen requirement. So the next 2 to 4 weeks are crucial to see whether this virus may be spreading faster, but maybe less lethal, less fatal, or maybe evolutionary because the viral load is high and H gene is mutated and deleted. Is it going to be more hurtful and harmful? And will it bypass medicines or vaccine? These are unanswered questions. So we really don't have data on that front. So this was my initial introduction. I know it was a little long introduction on this whole gamut of Omicron. But now we are going to learn from Dr. Rahul Pandit. He knowing this whole South African story, and of course, this story got highlighted because a patient from Hong Kong traveled on 22nd October to South Africa, and on 11th of November traveled back from South Africa to Hong Kong. Hong Kong has a 21-day quarantine. On 13th of November, he tested positive. So, Dr. Pandit, whatever you have learned and heard from the South Africa, number one is my question is that we are in India, and somebody tweeted today that the virus called Omicron is spreading faster in social media than in the lungs of human beings. And in India, we know there is no case. That's what you just announced. And our Honorable Health Minister Mansukh Mandviya ji also just announced in the Rajya Sabha in the question hour. So, what are the implications, Rahul ji, of Omicron on us as Indians? So, what are the implications? What should we do? And I can only tell everybody that there is no need to panic, but we were letting our guard down. So it is time to reprogram and reboot. Just like Dr. Rahul said that I am rebooted now. It is time for us to again reboot on a COVID appropriate mode. So Dr. Pandit, your first impressions on this novel new strain for India and for all of us, Rahul ji.
So, good evening, sir. I think the first impression is that we need to take up cognizance of it, but we should not panic. A lot of knowledge and experience has been gained by the world and India in the last 19 to 20 months. Now is the time to implement all of that knowledge into reality so that we can save ourselves and be one step ahead of the virus. That's what we want to do. So, what are the steps and what are the implications of this? So, let's go back to our basics, drawing board, as I said. The clear information which we have, which is absolutely cannot be argued against, is that mask works. And I would like to take this opportunity to again emphasize the importance of mask. Masking, double masking, is what is going to basically help us against any and every variant which any virus would produce us and give us into the atmosphere. So please, when you step out of your house, double mask, wear a cloth mask, and on top of that a surgical mask preferably, so that you have a good seal around your mouth. And for frontline workers, which includes doctors, paramedics, it also includes people who are working in bank, policemen, people who are working in media, so on and so forth, they should wear a N95 mask. That's the first thing to do. I would still say that while it may not be possible to have social distancing in a local train in Mumbai or a metro train in Delhi or so on and so forth, try and avoid going to crowded places as much as you can. If it is inevitable, like going to work every day, make sure that the mask does not come down at any cost. And the third thing, which is the approach which I'm talking about, is mask plus approach or the vaccine plus approach. The third thing is vaccinate. So we definitely have concerns, as Professor Joshi mentioned, that there may be some immune escape phenomena seen because of the mutations which we are seeing there. But we definitely know that masking and vaccine are the ones who are going to protect us. And vaccine will give us some amount of immunity. I just don't know what would be the efficacy of the vaccine, but it will definitely have some amount of immunity. For the two vaccines, they should be that should be basically available in the market right now, which is Covishield and Covaxin. And secondly, the newer vaccines which are coming, and of course Sputnik as well, beg your pardon, and the newer vaccines which are coming, if they get a permission to be given to or administered over the next few weeks, they will also have good amount of immunity when combined with mask. So that's the first thing. Do not panic. The second thing is we should now use our previous experience, for which government of India has already taken a significant amount of cognizance. We are scanning people at the airport. We are making RT-PCR compulsory for people who have come from the high-risk countries or at-risk countries. We are also instituting quarantine precautions. Some of the states may take up a more stringent view. I think they are allowed to take a more stringent view if that's what they wish to do. But I think this is the bare minimum which Government of India has put in, the Minister of Civil Aviation has put in. We as responsible citizens have got one more responsibility on our shoulder apart from vaccine and masking up. Vaccine, please convey this message to your friends and colleagues who have not taken a vaccine, that they should start their vaccination program immediately. If they have missed out on the second dose, they need to go and take the second dose. And another thing is, be responsible citizen, and please come forward with any signs and symptoms which you may exhibit, or people who have traveled and have come back and are now experiencing any signs and symptoms which may be of COVID-19. I think if we do this, the disease may perhaps be milder, and if the disease is going to be milder, we will probably come to know the entire spectrum of the disease and symptoms in the next 2 to 3 weeks time. As Professor Joshi said, by Christmas, hopefully, we will be much more knowledgeable about this virus and what it does. I think with this we would start taking up some questions from the viewers. If there is anything specific that you want to ask, please feel free to put it into the chat box. But a couple of questions which I have, I think we need to put at rest this question about booster dose. So, sir, I think a lot of 3 or 4 questions about booster dose have come across. What is your opinion, and what is the stand which we know right now from the NTAGI, which is the highest committee for vaccination from India? Of course, there may be some official statement coming out from Dr. N.K. Arora, but still, whatever we know, if you could just highlight that up, sir.
So if anybody wants to know the debate on booster and dose, please go on the 10 o'clock show of the debate yesterday night on Republic with Arnab Goswami, where Dr. Arora and myself are there. And I just want to give you a very crisp view. Number one is that science-wise, we need an additional dose and possibly a booster dose in eligible population. Currently, where does India stand both for adults and pediatrics? Large exposure, which means 80% of seropositivity in children and maybe 80 to 90% or 95% of seropositivity in adults. Now, there is probably a large population which has taken 1 dose or 2 doses and have had COVID, which means if you have taken 2 doses and had COVID, it's hybrid immunity and it is as good as a booster. So the government of India, in all probability, in the next 2 weeks, is likely to come out with a guidance on three accounts. Number one, on additional dose, which means despite of completing your primary immunization schedule, which is of 2 doses, still your body has got some disorder, like which has made your immunity moderate or severely immunocompromised. For example, if you have a disease like cancer or immunosuppressed state or a rheumatoid arthritis, or you're on steroid, or you're on organ transplant suppression medicine, then in those categories they will be listed. You'll be given an additional dose. Which dose? The data is being studied. Should it be mix and match? Most likely, if you have taken Covishield, should you take Covaxin? If you have taken Covaxin, should you take Covishield? All that data is being analyzed and a directive will come. Booster is for those people who never had COVID, two doses, 6 months have lapsed. And then there will be a hierarchical preference how it will be administered. Probably in the same way it was administered earlier, the healthcare workers, the frontline workers, the senior citizens, and comorbidities. That is how it will be administered. But this is all work in progress. Right now, don't get panicky that there is no booster. If you have had 2 doses and COVID, it's as good as a booster, and the guidance will come. From a science standpoint, yes, it is needed in the vulnerable group who is most susceptible. But having 2 vaccines clearly saves lives and severe disease in most people. So public health is based on a principle for most of the time for most of the people. While individual health is based on an individual's right for that individual, what is the most crucial and what is the most compelling. So when the public policy planners think, they don't think for a individual, they think for the larger good of the nation. They want to ensure that people who have had 0 vaccines, because Rahulji, the pandemic is now circulating in the unvaccinated population. And that is why they have taken their time, but it is scientifically needed, all for the healthcare workers, as well as for the frontline workers, as well as for senior citizens and all the comorbidities. So if the vaccines availability is not a challenge, it is definitely needed. But the science is being generated and a policy will come out very soon. So that is where we'll stop this. And probably this is my last question to Dr. Pandit, and we'll close the show. Is that, Dr. Pandit, I think double masking, air ventilation, and vaccination are the 3 pillars in Omicron times. So I know that you, with me, led this movement of double masking. A lot of people are still using cloth masks. And I personally feel that's not the best. So your final take, rather than being fearful of a lockdown or a disruption, this time it's going to be different focus now. So that focus is the final take home point. How does from now on India handle the Omicron?
Absolutely. I think lockdown is something which none of us want, none of us can probably afford, and none of us should even aspire for. But to prevent a lockdown like situation, what we have to do as a responsible citizen is to wear a double mask. I am again and again repeating with Professor Joshi, since the February 2021, we have been saying this. It's almost been now 9 months, a full gestation period has gone through, and we are talking about double masking, and very few people actually still implement that. Either you double mask or you wear an N95 mask. There is no two ways about that. That is the only thing which will protect you. Do not go and look at your antibodies and think that I have got antibodies coming down or going up. If you have the money to actually do an antibody test, might as well invest that 2 3,000 4,000 rupees into buying a mask and wear that mask for the entire year. That will actually give you more protection. Masks are important, and masks are the only ways to actually protect you right now, along with the vaccine. And please don't panic. Panic is just going to pump up and fuel up a lot of hysteria and a lot of wrong decisions. Continue with your normal work. Do not think that you have to sit home because this virus has now been identified in South Africa. As long as everyone follows COVID appropriate behavior, this virus has no chance to actually affect us and disrupt our daily lives again. So we should not allow that to happen. And for all you know, it might be a milder variant, and in 2 or 3 weeks' time, this may actually turn out to be a false alarm, which is fine. At the moment, if that's what happens, that's a blessing in disguise. But if it is not a false alarm and we let our guard down, as Professor Joshi mentioned some time ago, then we are in trouble, because then we will invite trouble in our doors, and then we will be left thinking that why did we not take precautionary steps when the time was in our hand and in our favor. And right now the time is in our hand, in our favor. Just take simple precautionary steps and it will be enough. Thank you very much, Professor Joshi, for joining us on this show. Thank you very much.
Thank you. Thank you, Rahul. So we are on Dr. KK.